Kim, what's on your radar?
While speaking at the Munich Security Conference this past weekend, Bill Gates was asked about where he thinks we're at in regards to the pandemic. Here's his response.
Where would you assess where we are today in beating COVID-19?
Well, sadly, the virus itself, particularly the variant called Omicron, is a type of vaccine. That is, it creates both B cell and T cell immunity. And it's done a better job of getting out to the world population than we have with vaccines. If you do sero surveys in African countries, you get well over 80% of people have been exposed either to the vaccine or to various variants. And so, what that does is it means the chance of severe disease, which is mainly associated with being elderly and having obesity or diabetes, those risks are now dramatically reduced because of that infection exposure. And, it's sad we didn't do a great job on therapeutics. Only here, 2 years in, do we have a good therapeutic. Vaccines, it took us 2 years to be in oversupply. Today, there are more vaccines than there is demand for vaccines. And that wasn't true. And next time we should try and make it, instead of 2 years, we should make it more like 6 months, which certainly, some of the standardized platform approaches, including mRNA, would allow us to do that. So, it took us a lot longer this time than it should have.
So there's a lot to unpack here in that clip, so we're going to break it down bit by bit. First, he says, sadly, Omicron is a type of vaccine, that it creates both B cell and T cell immunity. Now, why he says sadly is anyone's guess, and many people are speculating. We know Omicron comes with a much lower risk of death, so it seems like it would be more of a relief than sad for Omicron to be infecting people and giving them protection from more severe possible future variants. But the fact is, he admits Omicron is a type of vaccine. In other words, Bill Gates admits natural immunity is a real and robust thing. Where was he when when nurses and doctors were being fired for refusing vaccines because they already essentially had one previous infection? He then goes on to talk about Africa and how 80% of the population in many areas of the continent have been exposed to either various variants of the virus or to the vaccine, and this has given them protection. He says the chance of severe disease is now dramatically reduced because of it. And I'm not sure what's sad about that, especially when you take a closer look at Africa. Africa has fared quite well during this pandemic, despite having hardly any vaccination. Here's a map showing vaccine doses administered per 100 people. You can see Africa has very low rates of vaccination. All the areas that are light yellow have a vaccination rate of around 5% or less. Yet here's cumulative deaths per million. So there it is. Africa has had very low deaths as well. However, according to seroprevalence data, many areas of Africa were hit hard with the virus. Last month, NPR covered Africa's high seroprevalence in a piece titled, "Africa May Have Reached the Pandemic's Holy Grail." In the article, they detail how scientists in Malawi were shocked to discover that the majority of Malawians had been infected long before Omicron emerged. The scientists discovered that Malawi, I keep messing up this name here, but you can forgive me, right? Malawi, along with many other countries on the continent, had already reached an endemic stage, with 80% of the population having already been infected before Omicron. The same discovery was made in Kenya, Madagascar. Jambo, a researcher working on the data, said there was absolutely no way we would have guessed that this thing spread that much. They were expecting it to be somewhere around 10%, not 80%. And the reason they wouldn't have guessed this is because they hadn't had any overwhelmed hospitals and deaths in the area like much of the world has experienced. So the article says country after country there seems to have experienced the same pattern, a huge rise in infections that has not been matched by a commensurate spike in hospitalizations and death. So it's curious as to why Africa was apparently hit hard with previous variants, yet never went into crisis modes. Now, there are various theories. The continent is younger, and we know younger people do much better against COVID, but there are still elderly people in Africa, and yet they weren't showing up to the hospital in droves. Another theory is Africa is, by and large, much thinner, with lower rates of diabetes and heart disease. We know COVID tends to be worse in the obese and those with hypertension and diabetes, so it's possible their lower body weight saved them. Others say it was the continent's regular and widespread widespread use of ivermectin. Bill Gates said, "It's sad we didn't get good therapeutics until 2 years into the pandemic." Well, maybe we would have had some sooner had we not demonized every promising option and actually conducted honest studies. Nonetheless, the virus ripped naturally throughout Africa with very few consequences, and we should probably figure out why. Now, this should also cause us to question all of the measures we've taken and how effective they've been. Johns Hopkins has already come out saying most of our measures have caused more harm than good and shouldn't be used again. Yet, here's Bill Gates, seemingly recommending that next time we do what Australia has done.
Is it possible to prevent the next pandemic?
Yes, if every country does what Australia did, then you wouldn't be calling it a pandemic. That's all.
Yikes. Bill Gates is not a doctor. He's not a scientist, an epidemiologist, or a health expert. But he's a man of disproportionate influence because in this world, money nearly buys everything, and it certainly buys power. He has given billions of dollars to some of our most influential organizations that make decisions on how we handle these sorts of health situations. If he's walking away from this thinking Australia is the way to go, then people who value freedom and choice should be worried, especially since he says we'll see another pandemic, and Robbie's really going to hate hearing this, but he says we'll still be forced to wear masks to some degree. Take a listen.
In terms of combating COVID-19 and the potential for another pandemic, are we going to see another pandemic before we are able to beat this one?
Well, we'll have another pandemic. It will be a different pathogen next time. We'll have some rebound. This pathogen, we don't have a tool to do eradication. We'd like to have a new generation of vaccines that would be suitable. I mean, ideally, we'd get rid of families of respiratory viruses, including the flu family and the coronavirus family. And I do think in the next decade we can come up with an eradication vaccine. That's an aspiration, not a guarantee, but we should put R&D dollars into that. There's already a lot of work that's been done on a universal flu vaccine, and the data on that looks very promising. So we'll have rebounds, but they'll be more typical seasonal flu levels, where, of course, we don't generally shut things down, although in the future some degree of mask wearing probably will be indicated, but we won't get death levels at the kind of acute level that we're still experiencing today as the Omicron wave passes through on a global basis.
So are you guys ready for the next pandemic?
Well, all in all, though, that was certainly not the most unreasonable I've seen Bill Gates at. If he didn't say that he was necessarily advocating masks be mandatory. There might just be people who choose to wear masks every winter, even in America, the way they used to do in Asia, right? Which is probably true, regardless of whether I agree with it. And then he said, what he was saying about natural immunity, it was good that he was acknowledging that. So I don't know. It was kind of reasonable from him.
My guess was that when he said sadly, what he meant was he felt like he was in competition with natural immunity, and that he wanted these vaccines to sweep the whole world and be the thing that gave everybody immunity.
And also the Australia thing. That was the other thing. It sounded to me he was kind of snickering at the idea of doing if everybody did what Australia did. I hope to God he wasn't recommending that. That's insane. Maybe he was, but it sounded to me like that was more a joke. Like, well, if we all, shut down everything for forever, I guess it would dent the pandemic. It would just also destroy our soul.
If we never saw another human being.
Yeah, right. If you stop breathing right now, you would decrease your chance of catching COVID. Great, wonderful.
Just hold your breath. Hold your breath like they do out here.
But
when
you brought up, Kim, about why are healthcare workers still being under this vaccine mandate if they could show they've already had the disease? This was a question. I don't know if you caught my radar last Thursday. This was something that I had this audio file of Congress meeting behind closed doors with Rochelle Walensky, and John Joyce, a Republican, said, why on earth, based on now, given what we know about natural immunity, what the CDC itself has recognized about natural immunity, shouldn't prior infection count for the vaccine mandate, which was left in place by the Supreme Court for healthcare workers? It obviously should, and she had no answer to that.
Yeah, and also, the idea of the vaccine mandate in general anymore. I mean, just listening to Bill Gates at the end there and him saying, we're not going to have a vaccine that gets rid of these coronaviruses maybe for another decade or longer. at best, being hopeful about that. So having a vaccine mandate, we know that being vaccinated or even having natural immunity does not prevent you from potentially spreading the virus. And now the argument has shifted once again, as the goalpost always moves, to, well, it's not really about that anymore. It's no longer about sterilizing it and not spreading it. It's now about how sick are you going to get, and are you going to overwhelm a hospital? Are you going to have days off of work? I find that argument particularly interesting, especially coming from so many people who, were against, who were very pro lockdown, because they said, oh, if you're pushing people out there to go back to work for their corporate slave masters, and now they're saying, well, people need to get healthy faster, so that they could go back to work for their corporate slave masters. But, to even have the mandate at all and say, well, it's about your health, it's about how sick you're going to get, how, you're going to overwhelm hospitals, and it's, we have a precedent in this country at this point, luckily, that we don't ask questions, for example, of women when they apply for jobs. Are you going to have children? Because if you ask that question, what are you implying? They're going to have time off work. They're going to be away from the workforce. They're going to maybe overwhelm a hospital if all the women get pregnant at the same time, especially during the lockdown if they got nothing else to do. So, there's a lot. I think that obviously I think we're moving forward in the pandemic, and there's more restrictions being lifted, and more people like Gates are coming out that maybe were not saying certain things that now are saying certain things. But I think it's time to, I know we've always said this many times before, but it's time to let it all go. But Gates is a very powerful man. So I don't think he was joking about Australia. If you watch the entire clip, he actually seems to think that they did it right. And I think he was kind of saying, well, if we all had done that.
Yeah,
and
they
that's
did.
scary.
No, as you pointed out, Africa did it right, and we don't even know what they did. It's
Right.
a
We don't
mystery.
even know what they did.
Look at that
Right.
map. Like, compare Africa versus South America. South America had pretty bad outcome. Africa has a pretty good outcome. There's usually similar levels of kind of, poverty, a third world sort of environment. Massive disparity in this case in COVID. We don't really know why.
Well, they had fewer.
We should figure it out, though.
They had a lower testing capacity, and so, like Trump said,
Maybe it's
fewer
that.
tests, fewer cases.
Maybe it's that, but
Cases,
but,
cases.
it looks like it looks like more than that they've actually
Right,
had
yeah.
a better time with it.
Yeah, because in
something
Africa
interesting's going on.
they definitely were not testing in Africa. When you actually look at the testing maps, Africa is also very light. They didn't test, and that's why they were so shocked when they did the seroprevalence, and they were like, whoa, 80% of everybody's already had this. How did that even happen? And they were so shocked because their hospitals never were overwhelmed, even with that many people. They thought, based on their hospital data, that only 10% of them had COVID. That's how low their hospital rates were. We really should be looking at Africa to find out why, and then maybe moving forward, we have that discussion. I do think that obesity probably has a lot to do with it.
Yeah, absolutely. And we have better data in the U.S. for how many people have actually had this thing. The CDC has wastewater data that it just hasn't released because, well, they didn't feel like it yet. So still waiting for that.
Oh, Kim, speaking of COVID, the trucker rally leaves from Adelanto, California tomorrow. How far is that from L.A.? Where's Adelanto?
Where? I have no idea. I live in a bubble in L.A. right now. Are you saying it right?
Adelanto?
How do you spell it?
I'm looking it up.
Adelanto.
Finding it on the map. It is.
Adelanto.
Oh, it's kind of near L.A.
Let me check here. San Bernardino. So it's out in the valley. Oh, interesting.
So the convoy meets up there, and then they're going to cruise across the country and
all the way to D.C.
and annoy Robbie on March 1st by shutting down traffic right here in D.C.
Right, but for a good cause. But they shouldn't do it. But also, we should just end all the mandates. So don't. And in conclusion,
what mandates are left?
I don't know. They should blockade Brianna Nadeau's house, that councilwoman who wanted to bring back the mandates in D.C.
There's still a cross-border mandate. There's a cross-border mandate from the U.S. to Canada for the truckers. So maybe that's what they're...
Masks on planes. No good.
And mask up. Right. We'll see Robbie out there. So when they show up in D.C.,
I'm going to put on my
Robbie
trucker hat. Obviously, I wouldn't because it would mess up my hair. But all righty, we got to go.
Can't wait to see it.
Thank you, Kim. And we'll have more Rising in just a minute.